Welcome everyone. This is our first online session, the 2452 Medical and Wellness Group. We're so excited that this is happening. And I would like to thank, first of all, our past district governor, because he was the person who made it happen. Thank you very much, past district governor Mazen. I would like also to thank our actual district governor, Ashot. When I was sitting with you, Ashot, you were keeping this and putting this as a priority. And I thank you for that. We need your support for this year, and I'm sure we'll make an excellent year. We also thank our incoming district governor, George Azar, who immediately jumped on the occasion and told me, Rami, I need to be with you and join you. And I would like to thank also the past Rotary President, Rajendra Sabu. Thank you for being with us. You were with us during our induction, our first session a few months ago, and you are now here with us. Thank you so much for your support. I would also like to thank.
I would like to have an apology for exiting, because we have the other family. This is the occasion of the festival, so I hope you'll understand.
Okay, thank you so much, Rajan.
Yeah.
Okay, and also I want to thank each one of you joining us now. Now, I will be very fast. What is the purpose of this medical group? It is to bring medical professionals from all around the district. We are around 125 Rotarians. We will be linking each other. We will be linking to each other, and we will be doing and enjoying scientific activities, projects, supporting Rotary, enhancing the image, and much, much more. Okay. I will also like to give a big thank you to Josie Norfolk, who is the actual president of HURAG. HURAG is the Health and Wellness Action Group, Rotary Action Group. You can go and connect to HURAG on their website and know much, much more about it. We are the first in this district. The 2452 is the first chapter of HURAG, and we encourage other districts to do the same. It's a beautiful and a unique experience. Now, just to give our Rotarians with medical background an idea, you are becoming immediately, because you are from a medical background, immediately members with us. You just need to contact us for us to send you your membership certificate. And last but not least, I will give the floor to each director. We are 9 directors, each one from each country of the district, for them to introduce themselves and to give you an idea about themselves very fast. So I am Rami Sarkis. I am a dentist. I am a Rotarian at Rotary Club Beirut Cedars, and I am the chairman of the 2452 Medical and Wellness Group. Bharat.
Good evening, everybody. I'm Bharat Bhutani. I'm an internist, Dubai-based, and I practice internal medicine. I'm currently assistant governor of 2452. I'm immediate past president of Rotary Club of Jumeirah. And I represent UAE on this medical wellness group.
Thank you, Bharat. Lina, very, very fast in few words. Lina from Jordan.
So good evening, everyone. I'm a pharmacist. My name is Lina, and I'm from Rotary Club of Amman, Jordan River, and I'm incoming president for the next year.
Excellent. Dr. Soren from Armenia.
Hello, everyone. My name is Soren Sherbakyan. I'm from Armenia, past secretary of the Rotary Club of Yerevan, District 2452, the board member of a medical and wellness group from Armenia, and I'm a dental specialist, therapeutic stomatology, which means cosmetic dentistry and endodontics.
Thank you, Soren. Dr. Omar from Bahrain.
Dr. Harb Al-Umari. I'm consultant dermatologist working in Bahrain. Before that, I was working in Saudi. I joined Rotary Act in the early 70s by the help of the late Dr. Jamil Wali. I don't know if the old Rotarians, they know him. He's a legendary guy, and he selected the best people in the whole University of Cairo, and they put them in the Rotary Act. We went to Saudi, we didn't work because there was no Rotary. When I came to Bahrain, I managed to get, I asked about it, and Dr. Abdurrahman, Mr. Abdurrahman Yusuf put me in Rotary, so I joined it. So since 2003, I am a Rotarian, but there is one thing, I did not apply for being a president or something because, 1 minute, because I'm very busy, and that's it, full stop.
Thank you, Dr. Har from Bahrain. Dr. George from Cyprus, very fast, few words.
Past District Deputy Governor George Pavaleondiou. I'm now the country trainer of Cyprus. I'm a Rotarian of the Rotary Club of Famagusta, and I'm a dental surgeon.
Thank you. Dr. David from Georgia.
Good evening, everybody. My name is David Birkolidze. I'm a pediatrician from Georgia, from Rotary Club Tbilisi International, and welcome all Georgian attendants to this webinar.
Thank you.
Thank
you, Dr. David. Now, I will give the floor to two more very important persons for us. First, Josie Norfolk from South Africa, who is the head and the president of URAG, and our Governor Ashot. Please, Josie, the floor is yours.
Good evening, everybody. It's lovely to see you all here. I'm Josie Norfolk. I'm a member of the E-Club of Greater Cape Town in South Africa, District 9350, and I'm the chairperson of URAG. It's lovely to see you all here. I must give my congratulations to Rami and all the members of the board. This is our first chapter that we've started, and Rami was a bit of a guinea pig, and we have we've done a good job, and we are now trying to take this whole chapter episode to India. I'm now trying to start this in India. So hopefully you'll be the first, and you'll definitely be the best. Thank you.
Josie. Now, please, District Governor Ashot, the floor is yours.
Thank you, Rami. I'd like to greet and say good evening to all of our fellow Rotarians, Rami, President Josie, distinguished PDGs, dear Doctor, fellow Rotarians. Thank you for inviting me to this meeting. I'd like to emphasize the role of Rotary action groups, as action groups provide opportunities for Rotarians to engage in meaningful service in partnership with like-minded Rotarians outside in their own club, district, or country. And the Health, Education, and Wellness Rotary Action Group, as you aim to help Rotary members to learn how to advocate for and organize cost-effective, low technology programs to address this significant health issue. Congratulations with the first meeting, and I'd like just to add that we are planning to have a Rotary pre-conference before our district conference on May 11 in Radisson Blu Hotel, one of venue hotels of our district conference, and you all and from our district and beyond, you are all are welcomed there. Thank you very much.
Thank you, Governor. I also would like to thank again our incoming District Governor, George Azar, and our past District Governor, Mazen, for joining us tonight. Okay, so I will give now the floor to our scientific chairman, Dr. Bharat Bhutani, to introduce our speakers and to start our scientific meeting. Thank you.
Cancer is a name usually on part of the body which they affect. We all know that. And cervical cancer is a cancer of the cervix, the lower part of the uterus. That is, and the best part, as we come to know now, that this is a absolutely preventable cancer. This is an opportunity to add decades of life expectancy to millions of women and a chance to improve their quality of life. So we shouldn't miss it. November 17th, 2021 will mark the first anniversary of WHO's global policy to eliminate cervical cancer as a public health problem. So we are virtually celebrating the first anniversary of such a elite program of WHO. In today's presentations, we will learn about the WHO 1917-90 strategy to eliminate the cervical cancer. We will also learn about the types of the projects that Rotarians can undertake and how to plan and implement such projects. We will also share real-life experiences, examples of successful cervical cancer prevention projects. Said that, we start with Carl, who is a past district governor. Carl Dick Penbayo is a past district governor and a district Rotary Foundation chair. Carl began his Rotary experience in 1982 when he joined the Rotary Club of Bel Air Bluffs in Florida. Carl has been president of 3 Rotary clubs and is currently a member of the Rotary Club of Woodland in California. Carl was awarded the Rotary Foundation citation for meritorious services. And today, Carl's Rotary experience is enhanced by being a member of the CARDER and a board member of the HURAG, the Health, Education, and Wellness Rotary Action Group. As a major donor and Paul Harris Society member, Carl enjoys the privilege of supporting the many good projects of Rotarians all around the world. Since 2013, Carl has worked with Rotarians, NGOs, and health agencies around the globe to design and implement cervical cancer prevention projects. And recently, he was a participant in the WHO process that led to the adoption of November 2020, of a global policy to eliminate cervical cancer as a public health problem. Carl, the floor is yours. We're ready to listen to your experiences and advices.
Thank you, Dr. Bharat. And certainly, if I can just pop my screen up on screen share, that would be wonderful. And I hope that is all working now.
Yes, working brilliantly.
Okay, great. So first off, I would like to thank Rami. He has become a good friend and certainly helped us work through getting organized and working. And of course, your district governor, Asat, and I'm sorry if I fracture names, and past district governor Mazen, your leadership in all 3 of you in making this come together is very inspirational. I'd like to tell you today that I'm talking about cervical cancer prevention for Rotarians and how you can get involved, and Dr. Temple will follow behind me. First, I would like to tell you what HURAG is. We're the Health, Education, and Wellness Rotary Action Group. And we started as an amalgamation of a health fairs Rotary Action Group and out of an oral health and nutrition project that we did in Kenya. And our 2 leaders at that time, Sheila Hurst and Jane Little, helped amalgamate us and bring us into the Health, Education, and Wellness Rotary Action Group. So from the beginning now, we have added other subjects to our portfolio. Of course, tuberculosis and rotocare-free clinics, autism, prosthetics. But the focus today is on the cervical cancer prevention that we added to our area of emphasis. And it might seem, it was interesting to me how we evolved and got here. Now about 8 or 9 years ago, I was talking to an oncologist friend, and he had a desire to work on cervical cancer prevention in Nicaragua. And the reason he did, he made a trip there and he found that there was no family that was not affected or lost a member due to cervical cancer. So I helped him organize a vocational training team project. And over a little more than a year's time, we took 3 trips with more than 50 clinicians and other support staff to operate clinics and clinics. We did a train the trainer model. And we ended up outfitting 5 clinics across Nicaragua so they could upscale their work on cervical cancer prevention, primarily through the use of EIA and therapy. We also left some trained people who could train others behind, and so we felt that was a good project. Shortly after that, our chair at the time, Sheila Hurst, got a call from the Rotary International General Secretary, and he said, we had the American Cancer Society contact us, and how would you like to talk to them about cervical cancer prevention? Ultimately, we were invited to the Cervical Cancer Action Coalition meeting in London in November 2015. And that's where we reached an agreement with 74 other groups, such as the World Health Organization, Pan American Health, and NGOs like PATH to work on this project. And that's how we got involved in cervical cancer prevention. So today, we work on it, and we help Rotarians craft policy, design and implement projects, make presentations, conduct workshops, prepare reports and articles. And this is a photo from the meeting that I attended, the Pan American Health Organization. It was the consultation session for the Americas on the now year-old World Health Organization policy to eliminate cervical cancer. Now you're going to meet Dr. Temple shortly, and it's actually a lady by the name of Shania is working with us to design a major training project. And she attended this with me also, so we could represent that group out of Calgary. And Dr. Temple will explain that to you. So as I talked to Rami and others about this presentation, we wanted to know who we were talking to. And so District 2452 is quite a large district covering a number of countries. And so I had to start with trying to understand the makeup of the people we would be talking to. But the World Health Organization, this is an interesting statistic. Every organization you talk to has a slightly different version. But in 2018, the World Health Organization saw that there were 570,000 women were diagnosed with cervical cancer worldwide. And of course, as you can see, the death toll was quite large. Now, interestingly, there are pockets where, such as in the United States, Canada, and especially Australia, the death rate is very, very low from cervical cancer, but in other countries, it is quite high. And so at HURAG, we started out by preparing a guide for Rotarians that talked a little bit about cervical cancer. We're now on our third edition of this. We've received input from universities and associations and others, and we really see cervical cancer prevention work falling into about 5 categories: and advocacy and education, immunization, screening and examination, treatment, and palliative care. They're all very important. And so we talk about programs that can address each of these. And for Rotarians, advocacy and education for both advocating for resources and patient awareness is really an important area you get involved in. Vaccination is a little more tricky. We're best suited for roles in advocacy and aligning resources because the vaccines are expensive and usually have to be provided at the government level to have a sustainable program. And of course, the screening and treatment and palliative care are also things that we talk about. There's a wonderful project in South Africa where they Rotarians built a palliative care facility that serves as a model, because there are some people that is what is available. And so the World Health Organization wants to drop the incidence of cervical cancer down to 4 per 100,000, which is about where it is in Australia. To achieve that in the first decade, they want by 2030, they want to achieve a vaccination rate of 90% of girls by the age of 15. The reason they adopted that, although there should be more widespread use of vaccine, at the time this policy was developed, there was a global shortage of vaccine, and they had to pick the best strategy to make the biggest impact. Screening, if they can get 70% of the women screened using high performance testing by the age of 35, and again by 45, they'll interrupt this disease. The reason they want to go to high speed testing, which is very much like you're doing with your COVID testing these days, it brings the pool of people down that need to be screened to a much smaller number, and then the more invasive examinations go. Why that's important for Rotarians? These are projects that Rotarians can get involved in and bring people together for this. And of course, they want to treat 90% of women with pre-cancer treatment. And the tricky part, and anytime you plan a project, you have to try and make sure that if you identify a person that needs treatment, that they continue on the path to get to treatment. Many times programs skip that second step or don't manage it well. And so we try to encourage people to do that. And of course, they want to provide care for the women who will have invasive cancer. I took a look at your countries because I wanted to talk, I wanted to just figure out what your problem is. And so in each of your countries, I tried to model. I first off looked at your population, and I gathered that information from the World Fact Book, which is a good resource for that. And then I just did the math. And so, for example, in Lebanon, you need to be doing 2,992 vaccinations a year to meet this objective. And so these are just some model numbers to give you an idea of what the problem is you can work on. One of the problems that I identified in almost all of your countries is that is your migratory problem. All of your countries have significant refugee camps or other types of things that absorb migration. And so in some countries, it's probably even higher, but I saw one number, 43% of the population of one of the countries was this migratory section of people that are harder to get to. And so I just point that out as an interesting problem. Not much information was available in Palestine. I'm happy to say, though, Armenia seems to have a very effective approach to this. I know there's a lot I need to learn, but that's part of digging through the information. Finally, I want to show you why this is so feasible today. The lady on the left is the type of equipment that we were taking to Nicaragua in 2015. If I told you it took a full 24 hours to round up a tank of gas and an ambulance to travel 400 miles over rough terrain to get that to us so she could hold that and then treat women that day, that is what was available. Today, this little container, this little suitcase with this handheld item is what can be made available. So all of these are much more possible today. And with that, I would like to introduce you now, although I think somebody else will do the introduction, to Dr. Wally Temple, and he can carry on with the more technical part of the discussion. And thank you for your very kind attention. And now I'll stop sharing. Thank you.
Yes, please allow me, Dr. Bharat, just for a few minutes. Thank you, Carl. Thank you very much. And also thank you for Professor Wali for joining us and giving us this support. My message now is for all Rotarians in this session who are with medical background. I just want you to know that these kind of scientific events will become more frequent during the year. You can also be part of this. You can be a lecturer one day with us. And also you can be a lecturer in the first day full day conference that we will be doing in Yerevan during the district conference. So please, all Rotarians who are interested to become active, please let us know so we can work on this as soon as possible. Thank you. Dr. Bharat, go ahead. Thank you.
Thank you, Dr. Ami. Thank you, Carl, for such a wonderful information about what's going on in the field of cancer cervix and what we are doing for preventing it. Dr. Wali Temple is here with us for the technical aspect of the cancer management and what we are going to do and what it is about and how to prevent. Dr. Temple has practiced as a surgical oncologist for over 40 years. He's a professor emeritus of oncology at the University of Calgary. He has had many leadership roles as president of the World Federation of Surgical Oncology Societies, Society of Pelvic Surgeons, and Canadian Society of Surgical Oncology. He has lectured and operated in many countries around the world. He has numerous publications and topics ranging from surgical studies to importance of enabling hope in cancer patients and helping physicians dealing with adverse events. His current interests are focused on global elimination of cervix cancer with Rotary. These include Rotary Global Grant projects in Central and South America. He is especially excited about his work to help develop a Congress in 2023 for the Americas in collaboration with the Rotary and Pan-American health organizations to accelerate the implementation of the 2030 WHO targets of 90% of the children vaccinated, 70% of the women screened, and 90% of the patients treated. So let's hear from Dr. Valley Temple, what he has and how he's going to, and the strategy about it.
Well, thank you. Can you hear me?
Very much.
Good. Okay. Well, it's absolute privilege and pleasure to be with you today. And I'm just impressed with your group and what you're trying to do, and congratulate you on this venture that you're going on. So I will just see if I can get this working, as I'm probably better at surgery than I am at, there we go. Okay, can everyone see my slide? Hello?
Yes, fine.
Yes, it's okay.
Okay, super. So thank you once again for inviting me to be part of this. And as you know, Carl is just such an amazing person that works all around the world to bring this together. So huge credit to him and credit for your organization. I'm impressed also that I'm speaking with health professionals. I didn't realize that that was mostly your group background. So that'll make this even better. So I'm very excited today about speaking to you about a world without cervical cancer. The first cancer conquered in the whole world. This is incredible. This is a result of countries getting together, the World Health Organization. And so my message today is that, yes, it can be eliminated around the world, and we as Rotarians can help with the goal of eliminating this disease. I'm going to talk to you shortly about the science, why this challenge can be accomplished. And I'll just tell you a little bit about what our club has done so far and our plans for a Congress to implement many of these plans in the Western Hemisphere. So Carl has told you about this disease. It's a silent epidemic, and we just know about 600,000 women per year, but I'm sure there could even be twice as many because only 1 in 3 countries really have a good cancer registry. So at this time, we know that at least 1 woman dies every 2 minutes around the world. And most of these occur in the low middle income countries and is the most common cause of cancer death. And you can see here a map of the darker colors of where most of the cancers are. Of course, you can see in North America, Europe, and interestingly, in the Middle East, it is relatively low, as well as Australia. But Africa, most of Asia, South America, Central America, Mexico have very high incidence, as many as 1 in 20 in the highest incidence countries. It's a terrible cancer. It affects women when they're raising families. It's a huge economic toll in society because it takes them out of the workforce. And it's not it's a very morbid cancer affecting all organs in the pelvis and before it metastasizes. And the problem is that once they get this cancer, very few receive treatment. And the truth is, in many of the remote parts of the world, they don't even know what this cancer is, what it's caused from, and what it does. They have names for it, like in Guatemala, they call it basically the disease of the cauliflower in English. So you're all medical people, so I'll just tell you the cervix is kind of being ignored as not an important organ, but actually it's kind of an amazing organ. It's at the apex of the vagina, as you see, but it protects the uterus from infection. It secretes fluids so that the sperm can enter the uterus for fertilization. And it's this specialized epithelium that is which covers only about 1 centimeter or 2 that is the source site of the cervix cancer. So in November 17th, 2020, the 194 member nations signed the Global Action Plan to Eradicate Cancer of the Cervix. So we now have the science and we have the political will to eliminate this disease, as we've done in smallpox. And as you know, Rotary has contributed, I've heard estimates as high as $2 billion to help eliminate polio. There's only 2 cases reported this year in Afghanistan and Pakistan. So Rotary International actually has had members that have been active in this area. As Carl told you, he was involved in Nicaragua. There is now 40 funded projects over the last many years looking at prevention of cervix cancer around the world. And Carl has shown you this goal for 2030. The ultimate goal for a world without cervical cancer is targeted for 2120. And that is projected to save 64 million, prevent 64 million cases of cervix cancer in that time period. So let's just look at the science of what causes this disease, and will allow us to understand how we're going to prevent it. So fortunately, 99% of this disease is a result of an infection by 12 high-risk strains of human papilloma. And this is transmitted by sexual contact. But this is not a disease of promiscuity, which we often think sexual transmitted disease is from promiscuity. It's ubiquitous, and 90% of sexually active men and women will be infected with this virus in their lifetime. And the other risk factors is HIV/AIDS, which is 6 times the risk for getting cervix cancer. Now, most of us, men and women, actually reject this virus just like we do any other illness. But in 10% of women, it results in a chronic infection in the cervix, which takes about 10 to 15 years to transmit to become a cancer. And so that allows us the window to detect these early cancerous changes, which in high-income countries is mostly being done by pap smears, and of course is 100% curable. Once it evolves, the average cure rate in North America with good treatment is 66%, but it requires very complex surgery and very advanced radiotherapy. But in low and middle income countries, where 90% of it occurs, there's hardly any, very poor access to treatment and obviously no cure. So this slide shows you why we can prevent cervical cancer. It shows you the natural history of this disease and where vaccination will interrupt the development of the infection, and testing with screening will help identify those people that are infected and stop the disease. So the infection rate rapidly rises by age 15, so that by age 21, typically about 70% of men and women have been infected. And then over time, 90% become infected. Now, in their 20s, the precancerous changes start. It takes about 10 years. And this gives us the window where screening can interrupt that. And then you see that by 30 years of age, the cancers start developing. So that the role of vaccination, the role of screening has an enormous effect in preventing this cancer. So primary prevention, of course, is vaccination, and long-term that is going to give us the best outcomes. They have to be vaccinated before the age of 15, typically when they start getting exposed to this disease. Secondary, of course, is screening and treating women between 25 and 60. And just 2 screens will reduce cancer incidence by 60%. And finally, we have the tertiary treatment, which will be the hardest one to implement in the lower middle income countries because, of course, the need for major surgery and radiation. So the standard approach, which has worked, but it's very expensive, very complicated, and really not applicable in today's world, is the Pap smear. So it's done a wonderful job, but we have to move on. And of course, you see all the things that have to happen to have a Pap smear, which just don't work in countries with poor health systems. You have to do a pelvic exam, you have to preserve it properly, you have to preserve the specimen, send it to a pathology lab, which is read by technologists and pathologists. Then you have to recall the patient, you have to biopsy. If it's abnormal, you have to repeat it if it's indeterminate, and you have to do surgery. And then there's frequent follow-up. So the other problem that people don't realize that it has relatively poor or moderate sensitivity. In low-income countries, the sensitivity is in the 5 to 20% range. And even in countries that do it all the time, have well-trained people, it's only 60%. So that's the Pap smear. And we can be grateful that we've had it over the years, but in fact, a better technique has been developed for low middle income countries in terms of sensitivity and preventing cancer economically. And that is, of course, with pelvic exam where you paint the cervix with a concentrated vinegar solution. The precancerous areas turn white, and you have the opportunity to treat them right there. And you can apply a freezing or heating probe for a few minutes, eradicating these precancerous changes, and it prevents a future cancer. No biopsy is needed, and there is a false positive rate, which means some patients will get treated when they don't have it, but there is minimal morbidity, very rare complications of doing this. As Carl has shown, the equipment is carried around a suitcase now that we use a thermocoagulator. We can train a healthcare worker in a week to do it. We don't need physicians and nurses to do this. So it actually is more sensitive than Pap smears. And sorry, am I, everything, can you hear me okay?
Yes, everything's under control. We can hear you.
Super. And so now that they're producing handheld devices using artificial intelligence, the sensitivity can be as high as 90%. So here's the future, which actually should start today. And that is testing women for the virus, either with a vaginal swab, and now there's reports that you can do first void urine samples. We get the results in an hour, as Carl has said, just like in COVID, and you can treat them right there. And in studies that they've done, they've shown that its detection rate is 90%. In Mexico, it was 4 times better than PAP technology. Self-sampling increases screening by a factor of 4 in another country in South America. And here's the big advantage. Besides sensitivity, only 10% of women need to be examined because 90% of women have been cleared the virus. The screening interval can be lengthened, and now the World Health has made the current guidelines to say that HPV testing replaces PAP and VIA as the initial screening approach. And of course, it's more economical. So Carl has shown you the cryo gun, which is great, but it's got to have a big, heavy tank, which is replaced with this thermocoagulator. The cryotherapy tool or the thermocoagulator is placed on the cervix, and it only has to destroy the tissue 2 or 3 millimeters deep. to eradicate the precancer. This is a picture of a training session where they're treating the cervix by non-physicians, non-nurses. So in summary, we have the vaccines to prevent the disease. We have effective screening and treatment for early cervix cancer. And these two advances make a vision of world without cervix cancer a reality. So our club has been also involved, as has Carl's club, with projects. In Guatemala and Ecuador, we have just finished a study where we screened 2,000 women. We trained 8 gynecologists who have further trained 30 family doctor residents. And out of those 2,000 women, 140 were detected with precancers. And this is a sustainable project in that the family doctors are moving into the community, and Second Public Hospital is initiating this. Secondly, we've just had a global grant approved by Rotary International for screening 5,000 women in Ecuador, in Guatemala, with mobile clinics over a period of 2 years. We're training nurses, we're providing education to the community, and the new technology of thermocoagulators. We're buying those machines and introducing, of course, the handheld tool to diagnose the disease. So here's a mobile mission that I attended in 2020 in Guatemala. We drove, as Carl said, 4 hours over rough roads. We went 8 hours, but the roads weren't so rough, to the northern community leaving from Guatemala City. And this is typical topography of the mountains. And of course, Guatemala and Ecuador, they have jungles as well. And typical flora, which a little different from your end of the side of the world, tin roofs, keep up the rain, and their gardens surrounding it. This is their cook shack, where you can see the open fire where they cook their meals, and the smoke just percolates through the sides. This is the head of the NGO that we're working with that is going to do these missions, and this is a group of about 18 of us that were necessary for the mobile clinic in each of the 4 cities we visited. And this is a big day. There's a lot of advertisement through the radio and the local health promoters to get everyone to come on the one day. And we screened about 150 patients every day for 4 days with our team. It starts off with an education system, a session with a loudspeaker and flip charts to show what is the process going to be. When they come, this is the simple equipment, a little bit of vinegar, a swab. And here's Irma, our nurse, that and we were using a cryo gun at that time. They're very ingenious in how they use whatever the local circumstance are. Here's an examining table made from a regular desk. So this brings me to the last part, which we're particularly excited about. And Carl is one of our board members helping to develop the Congress of the Americas Cervical Action in 2023 with the tagline, "The First Cancer Conquered." So our Rotary Club in Calgary has signed an agreement with Pan American Health to develop and co-host this Congress, and it is focused on implementation. I think you brought that up as a major problem, Carl. It's all about the implementation now. The science is done. And basically the organizations that be involved is everyone involved in women's health. You know, Rotary International, of course, the governments, the health ministries, the pharmacy industry, IGOs, universities, lay people, and celebrities to help influence people, tell people about how important this is. It'll focus on workshops mostly for at least 15 of the countries to develop their own implementation plans and make them unique for their own country, starting from where they are. So some countries have done already well along the way in vaccination, but not in screening, and vice versa. And countries, of course, are struggling mostly with the treatment goals. And there'll be training workshops for healthcare personnel as well to diagnose and treat this. We will be focusing in this conference on the enablers for implementation. And this is being identified by the World Health. It starts with the leadership all the way from the government down to the districts, the regions, the cities, the towns. How to pay for it, obtaining medical products. And as Carl told you, we're excited because we probably will have the vaccines available, as we only need to vaccinate once instead of 3 times. The new information suggesting IT, social media, training the health workforce, and delivering the service. So finally, I would say cervical cancer can and it will be done. It will be eliminated. The science is done. The challenges in the implementation. And Rotary clubs around the world can make a significant contribution to accelerate the implementation of this vision. And each Rotary club that's interested, I'm sure, will have their own type of contribution. We would, of course, welcome all of you to our Congress to learn strategies that you could take back to your own countries. And for every year implementation is accelerated, we are saving millions of lives, or ultimately millions of lives of women. Thank you so much for the opportunity to present to you today.
Thank you, Dr. Wali. Thank you for this super informative session. And this is what it's all about. We as Rotarian professionals in the medical field should rally, should meet, should share our knowledge. And this, you brought us today a medical experience with a Rotarian experience. This is what we need really to share together in order for all Rotarians in the medical field to follow up this beautiful prototype. Thank you, Professor Wali, for everything, for every life you are saving and for every information you are sharing with us. Please,
thank you. And I would say that Rotary, it's all of us. The credit is our organization, and everyone as you belong as well. So it's not one person or one club. And that's why it's so wonderful to be able to talk to you, to share our experience and find out about yours.
Yeah, it's very touching. I was really very, let's say, touched by this action, by your interventions, by Rotary, by Carl's approach, by this huge collaboration between professionals, doctors, and after all, we're all here to serve above self and to save lives. I will leave now the floor for the Q&As with Dr. Barat and Dr. Lina Tara from Jordan, Dr. Barat from the Emirates.
Thank you. Carl, would you like to sum up the things before we go ahead?
Well, I can. First off, I'd like to say thank you all very much. Rami deserves an incredible amount of credit for bringing us all together and giving this. And of course, Dr. Temple brought the technical expertise that is so necessary to this group. So I hope all in all, we've made some contribution to your forward thinking. And we stand ready, willing, and able to talk to you about issues as you start to look to implement projects. I'm just going to stop at that and be happy to answer any questions you might have.
We really cannot thank two of you, Carl and Dr. Wali, enough for this comprehensive and such an enlightening two presentations. Now, the floor will be open to the audience and the attendees if they have any questions. You will please raise your hands and if anyone has a question.
So we have a question from Josie.
I just wanted to make a comment. I actually heard this morning that in England, in the United Kingdom, they started vaccinating girls in 2008, and the incidence of cervical cancer has been reduced by 95%. So the vaccination
Wow.
makes a huge difference, but it's obviously over a period of time. So
That's absolutely wonderful. And they also have done similar studies in Scotland showing the same results, that by age 20, there was less than 5% of these abnormal changes detected that they ordinarily would. So yes, vaccination has proved to be effective. It's absolutely wonderful. And that's going to be the main pillar, of course, to stop this disease.
yeah, we just need to get this vaccine.
Okay, and we have another question from AG Dr. Maha Qubain.
Hello and good evening, everyone. Rami, Lina, you are amazing. I'm really impressed by this group, and I'm so happy that we have it. My question was about the vaccination. I'm Dr. Maha AG Maha Qubain from Rotary Club Amman West, past president, and I was the polio chairperson last year for the country. I want to ask about the vaccination, actually. It's very expensive. How can we get it to Jordan? We need help through WHO, through Rotary, through whatever. That's what I know. So any comments on that?
Yeah, I don't know, except that in Brazil, they worked out with the pharma that it was $5. In Canada, my granddaughter and grandson, it was about $300.
Exactly.
So I believe with the new way we make vaccines, that costs will come way down. So I really can't comment on that, but yes, absolutely, the cost has to be come down, and I think it has.
No, it didn't.
Let me just offer a brief comment on that. If part of the problem with vaccines is how the nations have worked with organizations like Gavi and others. Some nations have contracts, some don't. And I think that the country has to have an initiative to reach out to the vaccine industry. And I believe there are some opportunities there. But it is my understanding that each country has its own problem and needs to work with the with the pharma industry to get involved in those programs.
Hopefully.
The other thing that happens, and if you don't mind me saying, is that the interest in the country can propel it up to the government to start to see this as a priority. And that is another thing that has gone on in some places.
Can I comment on that, please? Hello. Can I go?
It's okay with me.
Lina, is it okay?
Yeah, for sure.
Thank you. So as for Jordan, to get a support or raise the attention for this, how can I explain it? Like I worked in London, in England. In England, the NHS is responsible to treat patients and pay for them. In Jordan, it is not the case. So they don't understand how much does it cost. And it's usually the cost is on the patients themselves. So it's difficult to raise it for the country or the government that you are saving money if you are doing this and this and this. You get my point. It's
absolutely.
So
yeah. And this is one of the issues that will be dealt with or looked at very carefully in our Congress, because obviously it's, I think it's doable, but we'll have to get together. And I think also, as Carl mentioned, this is where Rotary can make a difference, because
exactly.
Influence in your own political systems, and they listen to Rotarians, and bringing this to the fore is critical. So yeah, I mean, we do polio vaccines around the world. We do lots of other vaccines which are cheap, and I think that this one will become another one of those in hopefully short time.
Hopefully. I'm really thankful to Rami for this amazing group. And Lina, you are doing a great job by raising the point in Jordan. But this is really a difficult subject. I wish we can do something through Rotary or WHO or whatever it is. Thank you all. Thank you.
The cost of the vaccine, probably the production is $6 to $10, so depending on which part of the world. So I'm sure once mass production is undertaken to give mass vaccination programs, the cost may further go down. And there will be, governments are giving the COVID vaccine free all over the world. So certainly there will be support available from the governments once WHO is at it. In UAE, in Dubai and Abu Dhabi and all the Northern Emirates, the vaccine is mandatory for the schoolgirls and they get it free by the government.
Yes.
So I'm sure more governments will.
In Jordan, it costs more than 500 JDs, which is above $500.
$700.
No, I'm a gynecologist. And Lina, for sure, she knows.
No, yes, the governments will have to intervene in this because the cost is $6 to $10, and selling it at $100 or $500 is not acceptable. So this profit-making thing has to go, and there will be interference in this.
I have a question.
Alina, is there any?
Please, Rami, go ahead. Rami
Yes.
has his hands up.
Question is for Carl and for Professor Wali. So do you find in some regions of the world some ethnical blockage to your action? Are there some civilizations, and I might be wondering if ours is part of this, some blockage, let's say you can have like religious ones or beliefs.
Yes.
So my first question is, how do you, we say it in French, contourner, how do you
Go around it.
Yeah, go around this? And the second one is, what can you propose to us as Rotarians in District 2452 as projects, clear projects, so we can join it? So we are not able at this stage to start one. Maybe if you have a project that we can join and be part of it with you.
Oh, amazing, amazing.
Well, let me start, and then I'll let Wally correct me or fix it or add to it. But, we've had a lot of experience going into different places. One of the things we run into when we do presentations is this is mostly a discussion about women. And the first question is, well, what about men? And then sometimes there are religious objections that we've run into. I remember one of the first meetings I was in a country, and I won't tell you where, and the people came to us and said, can you help us? Because this particular church is fighting against us giving vaccines. And so what you have to do, I believe, and it is my experience, that you have to be sensitive, listen to the objections, and then try to help people understand how to go around the objection. It is true, you will never get 100%, but what you can do is create a wall or a system that allows those that are receptive to participate and not have the others stop them. And it just takes a lot of work. And that's where Rotarians can be highly effective because they can communicate to their communities. So with that, Wally may have something that he wants to add.
Yeah, I think this is the whole reason why we're looking at a Congress on implementation, because it'll change from region to region, culture to culture, ethnicity to ethnicity. Absolutely. And if we don't appreciate all the individuality of where we're vaccinating and screening, we won't be successful. And this is a particularly sensitive area, being in women, where they need often leave their farm for the day to get examined, and the husband looks at her and says, oh, you look good to me, you don't need to go to the doctor. So that's the problem in Guatemala. And so on it goes. And so education, and as you say, being sensitive, the science is there, as one of your speakers pointed out, amazing results in England. Wow. And we're going to hear more of those amazing results in Australia. So our Congress is going to be so exciting because it's going to take each country and say what works in your country. But interestingly, it's not just what works in your country, it's what works in different parts of your country. So there's no one solution even in the same country. So it'll be exciting. And the only thing I can say, Carl has a repository of how you can be involved. We would love to have representatives from your countries to come to our Congress to see if this kind of a Congress might be useful in your part of the world as well, which I believe it will be. But this is a pilot and we're seeing if it works. And if it works, then we will be happy to advise you on how to do it and give you our lessons learned. Thank you. I have another Zoom conference going right now, so I will have to leave shortly. And if there's maybe one more question I can answer, I'll be happy. Otherwise, Carl will give you my address and I will answer you email. Happy to do that if there's some other things I can help you with.
Great. Thank you, Professor Wali. We have a comment from Bharat. Dr. Bharat, if you can.
Thank you. Thank you, Lina. A question to Carl. Carl, now that we have conquered almost polio, a lot of resources, Rotary resources which were being used for polio, they will be spared. Is there a thought process to shift those resources to the cervical cancer program? We have had only one case in Afghanistan and one case in Pakistan, only two, as Ashok mentioned in his meeting last week here.
Yeah, let me answer that question quickly as best I can.
Can I, Sindra, I have to leave, and I just wanted to thank everyone for the amazing opportunity and privilege to speak to you today, and I'd love to meet you in person in the future. So thank you again, and God bless.
And we would like to thank you for joining us from us here at the medical group and from all the Rotarians in District 2452.
And stay healthy, everyone. Bye-bye now.
Thank you.
Bye.
Thank you. Thanks, Wally. See you soon. Let me just go back to that question about turning the polio resources over to other projects. This is a difficult proposition for Rotary because Rotary is singularly focused on eliminating polio. And even at today's good news of only 2 cases this year, it's still 3 or 4 more years down the road before it's all wrapped up. But having said that, in many countries of the world, Rotary has left an infrastructure. Now, Rotary and its partners in the Global Polio Initiative have left an infrastructure of healthcare workers, laboratories, and other resources out there that the communities control and own. And now it is true, not much of that is here in places like where I live, but it may very well be in places like where you live or where you work. And so I think that I do not think at this time Rotary is ready, willing, and able to move forward on a global initiative for cervical cancer. But the resources for Rotary are available. For example, you know, you could look at your region and propose a program of scale. You know, that's the new grant model for Rotary. You could start out small with a train the trainer program that have a core group of people working with an NGO to travel from country to country, implementing some of these strategies for you. So there are opportunities to start. I would argue probably have to start small, but the infrastructure is available and it's just a matter of learning how to tap it.
Well, thank you, Carl. Thanks a lot. Let's hope for the best because as 2010, the cervical cancer financial burden was $2.7 billion, and 2030 it is supposed to be $4.7 billion. So huge resources will be required, certainly. Just to comment.
Absolutely. I believe that when we attended the meeting on the consultation with the World Health Organization, they described this as like an $8 billion problem, which is just about what's been invested in polio. And I just would like to end with this, and I want you to see the connection between polio and cervical cancer prevention, because the first polio vaccine was developed using a blood sample of a lady by the name of Henrietta Lacks. She was from Pittsburgh, Pennsylvania, USA, And she died of cervical cancer. And it was some of whatever little bits of her blood that Salk used to develop his vaccines. And at that time, the incidence of polio and the death rate and all were very much like what cervical cancer is today. So there's a continuum there. And I just rest with that.
Yes, but the difference, I'm sorry to interrupt, I'm sorry. But the difference was the vaccine price was very, very minimal comparing to this one.
Very, very different. That is very true.
What part of this program, which has been undertaken by WHO, is focusing on HPV in men?
Oh.
Well, okay, so let me answer that. The World Health Organization recognizes that ultimately the best way to, well, first off, if you eliminate it in women, there are like 7 other cancers that can be affected through the HPV vaccine. So it isn't that, but the greater impact now is with women by vaccinating girls. In the future, this program, once vaccines are readily available, the cost is manageable, the recommendation will shift to vaccinating all boys and girls. But to get the biggest bang for the buck, if you will, they had to start someplace. And for the first 10 years, if they focus, this is what they explained to me. This is not me deciding this. This is what I learned from them in the program we attended, is that they have to start someplace, and the best place to start is this first 10-year objective. And it was principally because of the availability of vaccine and the availability to get it out into the public. That was what drove it, according to the World Health Organization when I attended the consultation process.
Great. So I would like to take this opportunity to thank you, PDG Carl, for being with us today and for arranging for this amazing presentation and very informative session. I personally learned a lot, although I've worked on the vaccines for some time, but this has been enlightening for me, and I'm sure for everyone here in the room. I would also like to take this opportunity to announce that our next meeting will be on the 10th of December, where we will be hearing a very interesting topic about aging as a disease and methods to delay aging. I'm sure this topic will be of interest to many of us, especially the ladies, and it will be presented by our consultant dermatologist, Dr. Harbi Al-Omari from Bahrain, and who's now residing in Bahrain, and he will be talking to us on the 10th of December. An invitation will be sent to everybody in due time for the details. Meanwhile, I'd like to thank all our district governors, current, past, incoming, and nominees for being with us today. And for all the Rotarians who joined us, it was a pleasure to have you all. We can still stay and chat, but we have to officially close the meeting at the moment. But if anyone would like to stay and chat and know more about our group and what are our plans and objectives, please stay tuned and stay with us for the next 5-10 minutes. Thank you all, and wish you all a happy weekend and a good night for the moment.
Thank you, Carl. Thank you, Josie. Thank you, everyone.
Thank you. Thank you. Bye-bye.
Thank you, everybody.
Bye. Thank you.
Bye. Bravo, bravo,
Okay,
bravo.
Thank you, Rami. Thank you all for arranging this. It's actually was a great meeting. I'd like to say I love statistics, so let's go.
You did a great job.
Thank you. We've been.
It was the idea. This is the idea. Yes, the idea.
Thank you all, and I am waiting to the 10th of December. See you.
See you, David. Thank you.
Bye.
Thank you, Rami. Thank you, Rami and Lina. It was very informative session.
Can I interfere 1 second before we close everything? The topic will be very interesting. I will present the lecture. It will be how to consider aging as a disease and how to stop aging, and which is interesting for everyone. Thank you.
Thank you.
We look forward to it.
رامي ولينا بدي لسه أسأل.
So that means how to
مها خلي كل أسئلتك وبنبعتهم إذا بتحبي لبروفيسور والي on an email and I'm sure he
لا
will answer
بدي انتوا
everything.
الاثنين، انت ورامي.
اوكي بليز تفضلي.
انت ورامي، يعني انا بدي اشوف benefit out of this، مش بس انه lectures، عرفتي؟ بدي نشتغل انه نحاول نعمل orientation و awareness وهيك شيء يعني.
Hey.
Rami, we've got to do something about the timing in different countries, because I think we miss people, you see, joining us because of the timing.
Yes.
Yeah, you are right.
We must do it for every country, you see, when we send the invitation. And I'm sure that we get more people joining us during the presentation.
Yeah, lecture, sorry for interruption, lecture is very important. When we find a very strong lecturer in our meetings, the attendance is very high. So we need this to polarize people. And then the agenda of the Rotary and the treatment of the cervical cancer or whatever should be put secondary to the lectures. But the lectures is very important, and the topics are very important because it's polarized people, that's it.
I agree with you, Harb, but it would be nice also to have, for example, the topic we're having next time about aging is a disease. It doesn't need only medical people to attend. Maybe we can have every Rotarian to attend.
True.
Not only people.
True.
Today's topic was a strong topic. It was about the medical part that was presented was a strong medical entity. It needs a medical person to be there. But for example, if we have something in terms of awareness plus medical, we would be able to invite more people to attend the meetings.
Yeah, and one last thing, don't change the links. Put one link, 3 weeks at least before the lecture. So we can send it and not change.
Yes, I agree with Harp. We've got to have the invitation, you see, sent in within the next few days. And we can ask the Rotarians, any other Rotarians to join, you see, apart from medical and paramedical.
George Harb, we need to get advantage of other members that are joining us for the first time. The comments for this event, we will do it on another board session. Now let's get advantage of other members here that are interested to join us. You need to know that this group is all about connecting all the medical specialties together. And as Dr. From Jordan, I don't recall. Yes, Dr. Ma. Yes. I need to tell you that in our region we need international connections.
Yes.
Okay, and this is the biggest part. Bring along international speakers, international connections from our international Rotarians.
Yes.
They will open for us projects. They will tell us how to do medical projects and how to do it. They are more experienced than us. They are more advantaged. Now, the second advantage of our group is to give each one of us, each Rotarian with a medical background, the opportunity to bring his specialty as a fundraiser. See, it means if I am a dentist or you are an ophthalmologist or she is a dietitian, they can become lecturers, they can become fundraisers, and we can link them with international speakers. This is the main issue. Then for big projects, we can go back to our clubs. I am part of a club called Beirut Cedars. You are part of another club. We can give an added value to our club and link our clubs together. But our main mission now is to know each other, to get to know each other in an action group, and and to have the opportunity to bring our specialty and to share our knowledge with others, you know, and then things will come along.
By the way, I'm an obs and gynae doctor. That's why I'm so excited about this today.
Yes, and please, you are immediately a member with us, and you can become a lecturer. And please also book the date for Yerevan. We will all be in Yerevan next year. The district governor gave us one full day for the medical part. We have one full day. We will have sponsors. We will have sponsors.
Thank you.
International lecturers, and we can do also local lecturers.
What's that? What Ashot was saying?
Please, can you mute? There is a big echo. You need to mute, guys.
Is it me? No.
No, no.
I mean, is that what Ashot was announcing, the 11th, a day
Yes.
before the conference?
Yes, and this is done especially for our medical group.
By God's will, I'll be there, inshallah.
Yeah, we need to link together. And we have, and we are many, we are 125 medical Rotarians. Yeah.
We have to
Excuse me.
classify them now. Pharmacists, dentists, interns.
Excuse me, everybody. I would like to thank you all for this great session. It's a great initiative. Thank you guys, Lina and Rami, for arranging this. And believe me, if you will have a session in Yerevan, and of course you'll have a session in Lebanon, and the year after you're gonna have a session in Jordan, inshallah, when you all come to visit Jordan in our district conference. Thank you for inviting me, and I will always be there for you if you need any help. My name is Bashar Haddad. I'm the district governor nominee 2324 from Jordan.
Thank you. District Governor.
By the way, sorry for the miss picture. I'm talking from the lowest point of Earth in Dead Sea. I'm in Dead Sea. That's why. Sorry for that.
Yeah, it's I love this part.
What about it?
Jordan. Thank you for joining us.
Thank you, Bashar, for joining us.
You will have a homework with us during your year. We will be
believe me, Lina is doing the homework from now. Don't worry about her. Of course, Lina, we served together as an assistant governors, and she did a great job, and she's doing a great job now. يعطيكم ألف عافية يا رب.
Thank you.
Thank you, Bashar. Thank you.
Anyone else has any idea, any question for membership with our group?
I think no question for the membership. Just a suggestion that we should just immediately post today's brief about today's meeting on our social media, and also forward it to all the clubs